So I want to talk a little bit today about the type of pain you should expect after having a rotator cuff repair. So you see Stratton here has a abduction wedge on. That in itself will help decrease the pain by putting the rotator cuff on a little bit of slack when he's wearing it. But when we're coming in, you should have a degree of low-grade, dull, aching pain in a still or sedentary position. We have a lot of swelling. There was a lot of trauma, controlled trauma that occurred. And so we expect you to go through that natural inflammatory process. Now, that inflammatory process, the beginning acute stages, we're looking at about 7 to 14 days. So you should expect the highest amount of pain to be at that particular time. And then aside from that time frame, I want to address what type of pain you should be expecting during your physical therapy. So whenever we're doing the motion physical therapy, we always want to listen to the patient, go as far as the patient feels comfortable going to tolerance. As a physical therapist, what I feel for is something called an empty end feel to see how far I feel comfortable in moving or going through a range of motion. And then also having good, strong communication with the patient on what they're feeling. We should never really feel any quick, sharp shooting pains directly in the shoulder joint itself. Achiness throughout the shoulder and throughout the movement is expected though. So once we start getting through that range of motion, we start getting to the end of the tissue tolerance, that pain will start to go up a little bit more, and we just talk to the patient and we bring that back down, and we just stay moving within the range of motion at this early on in the rehab process. After the rehab, the pain should be achiness, a little bit of soreness, but no increase in sharp pain in the shoulder. Your doctor does expect you to experience some discomfort during this early process, so they will prescribe you some pain management medication to help you take before the therapy to help you go through those motions, because even though the pain is be super high at that time, some of the light ranges motions that we're doing are not stressing the tissue that much, but so the pain medication will allow you to go through those easier ranges motions with a little bit more comfort. So that's what you can expect early on in your rehab process.